Hi dear parents, let me help ease your tensions about jaundice, especially how to understand normal versus abnormal newborn jaundice. So the question is, why does jaundice happen in newborns? Parents, if your baby looks like a tiny golden mango in the first week, don't panic. That's jaundice, no doubt. But let's understand it before you panic. Here's the science simplified. All babies are born with a lot of red blood cells. These break down into a yellow pigment called bilirubin. The liver usually clears it out. But in newborns, the liver is like a new intern at work, still learning the ropes and works. So bilirubin piles up and the baby's skin turns yellow. The real question is this normal, harmless kind, or needs attention now kind? Let's decode that. Normal physiological jaundice. This is the most common type and it's usually harmless. It starts after 24 hours, mostly on day 2 or 3, peaks by day 3 or 5 and fades within 1 to 2 weeks. Sometimes takes longer in breastfed babies to fade away. Baby should be otherwise healthy, alert, feeding well, peeing and pooping normally. So now you should understand, where is it seen? It usually starts at the face, moves to the chest, then abdomen and finally to the legs as the bilirubin level rises. If it stays in the upper body and the baby is well, it's often safe. Think of it as a sunrise of yellow, slowly moving down the baby's body. So now let me explain abnormal or pathological jaundice. This is when we worry. It starts within the first 24 hours itself. Bilirubin rises too fast or too high. It lasts longer than 2 weeks in term babies or 3 weeks in those premature babies. Baby looks very sleepy, yellow, irritable or refusing feeds, dark urine or pale or white stools. Where is it seen is the question. Jaundice that spreads to the palms, soles and eyes is a red flag. Very deep yellow or slightly orange tone across the whole body is concerning. Here, the bilirubin levels may be dangerously high and can affect the brain if not treated quickly. The World Health Organization and the Indian Academy of Pediatric recommendations are, both WHO and IOP say, every newborn must be checked regularly for jaundice in the first few weeks. Regularly. If it's mild, feed often and watch. If it's early, severe or prolonged, investigate and treat. Doctors may sometimes use phototherapy, the famous blue light treatment, which is okay and doesn't have side effects when supervised. Only in very rare and complicated cases, the blood exchange transfusion is needed for that severe kind of jaundice. But remember, that percentage is very low. Quick remedies for parents at home. Here's what actually helps and what doesn't. Frequent breastfeeding, 8 to 12 times a day. This helps babies poop more, which flushes out bilirubin faster. The second thing, skin to skin contact. Kangaroo mother care keeps your baby warm, improves feeding and helps metabolism. The third thing, keep your baby well hydrated. Breast milk is enough. No sugar water or gripe water. The fourth thing, sunlight exposure. A little early morning light, indirect, not harsh sun, will help mild jaundice, but it's not really a replacement for medical phototherapy when needed. The fifth thing, monitor baby's urine and stools. Dark urine or pale stools noticed, then it's time to see your doctor. If you are ever in doubt, see your pediatrician. Early checkups in the first week saves lives. Here's what not to do. Don't give home remedies. Don't delay medical care. Don't stop breastfeeding. And most importantly, don't apply any oil or turmeric which will make the baby look like a mango instead of a newborn baby. Let me tell you some fun facts which will ease your stress. Over 60% of term babies and 80% of premature babies get jaundice. So you're not alone. The yellow tint follows a top to bottom pattern, which actually helps doctors judge the severity. Feeding and pooping are your baby's natural detox system. So the more the merrier initially. Here are 5 common parent questions on jaundice. 1. Most common question is that my baby looks yellow. Should I panic? No. If it's after 24 hours and your baby is well, nothing to panic. But always tell your doctor. Few initial visits to your doctor are definitely necessary. The second question, can breast milk cause jaundice? Yes. Some breastfed babies get mild, prolonged jaundice called breast milk jaundice. It's usually harmless. You might have to stop feeding breast milk for a few days, and as soon as this settles, your doctor will permit your feeding again. It's absolutely normal. The third question, do I need sugar, water, honey or herbal remedies? No, these are unsafe. Breast milk is the only medicine your baby needs for normal jaundice. Will sunlight cure jaundice? Gentle morning light can help mild cases. But if the bilirubin is high, sunlight won't cut it. Phototherapy is needed and it's safe. Can jaundice come back after treatment? Sometimes levels do bounce back, but with regular follow-ups, your doctor can handle it safely. So, here's your parent takeaway. Normal jaundice, remember, starts after 24 hours, moves face to chest to tummy, and your baby should otherwise be fine and active. Abnormal jaundice starts within the first 24 hours, spreads to the palms, soles and eyes. Your baby looks unwell and it lasts long. Most jaundice is normal and harmless, like a little golden glow in your baby's first week. But remember, if it comes too soon, spreads too far or stays too long, that glow needs a doctor's attention. Remember, feeding, watching and acting early are your superpowers. Your baby might look like a sunshine-colored mango for a few days, but with the right care, they'll soon be glowing with health, not bilirubin. Hope you guys got this easily. So now we will move on to our next newborn course video. Keep following.